Hello everyone, I am Dr. Priyanka Mohan. I am a fertility consultant at Cloud9 Hospital, Sarjapur Road and Bellandur, Bangalore. Women with irregular periods, if you're planning to monitor your ovulation, the fertile period, there are various methods of tracking ovulation. But the most reliable method would be through a follicular study. So follicular study is a scan where we start off the scan from the second day of your periods. We monitor the baseline parameters just to make sure there are no cysts which can be confused for a growing dominant follicle. So in a similar fashion, again on the 8th day or the 10th day, depending on the cycle duration, we follow up with serial scans every alternate days or once in 2 days, where the process of the follicular growth is monitored and eventually the signs of ovulation are monitored on the scan, thereby assessing whether you are ovulating or not in the first place. Because with irregular periods, there is also a possibility you may not be ovulating regularly. The best way to assess your fertility health in irregular cycles is basically through a follicular study. There are also various signs you can look into. One is presence of white discharge. Just before ovulation, it can happen. The other thing is increase in basal body temperature. So you feel a little feverish, you might feel a little tired, there can be abdominal cramps. So all these are various signs of ovulation which on a day-to-day basis you can keep a track of. Thank you.